Welcome to another episode of Government in Action. This is part 2 of this edition where we bring further insight into the developments of the public health sector. Have you ever wondered how the government determines what should be the priority areas of health planning and intervention? How do health officials determine what the public health priorities are? Let's take a look. The world over, where a country's health and wellness is concerned, it is the government's responsibility to provide the health structures to improve the health and wellness of its population. Continued public health surveillance, which involves the collection, analysis, and interpretation of health-related data, is therefore needed for planning, implementation, and evaluation of health practices and programs. Without such surveillance, diseases and illnesses can be misunderstood, leading to a lack of adequate health programs and initiatives and a misuse of resources. Minister of Public Health Dr. George Norton has said that his ministry is focused on ensuring that countrywide surveillance is conducted in order to collect adequate data for the provision of healthcare services. In this regard, the Public Health Ministry has conducted a mixed survey which is being implemented by the Government of Guyana and the United Nations Children's Fund, UNICEF. Chief Medical Officer Dr. Shamdeo Prasad, whose office was in charge of the completion of the survey, said that it offers an in-depth look at healthcare issues affecting men, women and children, with data being collected from over 6,000 households across Guyana.
Now we looked at the various conditions within the household, their compliance with immunization, for example, with the children. We weighed and measured the children also to see the proportion that were not meeting the milestone for growth and development, and those who were. For women, we checked generally their access to health services, their knowledge about common health problems, maternal issues, how they interact with the maternal services. We had a module dealing with safe water and sanitation. And for men, we touched on some of their access to health services, but we also explored a bit, their views on the gender relationship, the violence in the society, and those kinds of things. We also looked a little bit at alcohol and smoking too, which are important social determinants when it comes to ultimate health.
The survey has lent support to the completion of a standard treatment guide, which will aid in the delivery of primary healthcare services countrywide.
A great effort was made by those who are entrusted in doing so, and I am personally impressed with the quality of work that was done. And I know it is very helpful for especially our new physicians, our recently graduated physicians who might be placed in areas that they don't have readily access to persons of more experience. But that guide is very useful for them. And we have been able to get that out and distribute it as much as possible.
Broader than managing health priorities, disease control is critically important. Outbreaks and communicable illnesses are costly, both in terms of lives and financial resources. Within the Public Health Ministry's Disease Control Program, the collection of data helps to accurately describe and assess the state of health problems in the country. This in turn aids the improvement of healthcare and the effective allocation of resources. Disease control covers the management and prevention of vector-borne diseases, chronic diseases, and all other disease-related threats to the population. Where vector-borne diseases are concerned, President Granger has called for a broader national effort in the fight against such diseases.
We need to develop a much broader approach to combat this public health threat. That approach must involve a more careful management of the environment. Vector-borne diseases must be tackled as an environmental hazard. Vector-borne diseases are linked to human activity, and particularly in our country, to reckless and irresponsible environmental practices.
Minister Norton said that the ministry has made significant changes within the Vector Control Unit to allow for better administration, control, and prevention of these diseases.
In that area, we had to look at, of course, the malaria, which has been with us for all this while, and we have managed to reduce the number of reported cases, and we were able to give them a more prompt treatment to those who would have been infected with the disease. And we have treatment readily available, as well as the opportunity for testing, and this is right across the country. But apart from malaria, we were happy to be able to be in a position to manage the situation that was presented by the Zika virus. That is not to say that we were probably affected to a large extent by chikungunya, but in the last year, where Zika has really come on board, probably because of the fact that we had been fighting against mosquito-borne diseases, and the Zika virus is mosquito-borne, we were in a position to have control over the extent to which that would have affected us.
The minister said that the ministry continues with stringent sensitization of the public on disease prevention. He noted that the recent cleanup of Georgetown has aided in the reduction of mosquito-borne diseases. Meanwhile, the fight against HIV/AIDS in Guyana continues to be an ardent one, the minister said. And while there have been reports of an increased number of HIV cases in Guyana, there have also been both victories and disappointments in this area.
We can safely say that we had for the year so far, no mother-to-child transmission of HIV. Or we had no HIV infection due to blood transfusion. While I agree that there was a shift of the persons that are infected, we find that a younger sector of the population, mostly the new cases affecting a younger sector of the population, we're not happy about that, but we continue to work in that, in trying to curtail and to educate the population about the different measures that they can take to prevent the spread of HIV/AIDS.
Much of the sensitization efforts, the minister said, are also plugged into breaking down the barriers of stigmatization and discrimination of vulnerable groups.
And we have been working on key populations, men who have sex with men, the sex workers and so on. We have been trying to break down all barriers against those persons and giving them as much an equal opportunity of accessing medical care for their treatment in that area. We had recently an HIV dialogue, HIV and the law dialogue, which I think was tremendous success because we had a wide cross-section of the Guyanese society participating in that dialogue.
Efforts within the Disease Control Unit would not be complete without looking at the work being done in the area of chronic disease. Chronic non-communicable diseases remain the #1 cause of death in the country. Coordinator of the Chronic Disease Control Unit, Dr. Kavita Singh, explained that the unit is responsible for ensuring there is a multi-sectoral and integrated approach to tackling the 4 key areas: cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. Lethal though they are, however, Dr. Singh said that the development of these diseases is also heavily based on common risk factors such as the harmful use of alcohol or tobacco, unhealthy eating, and physical inactivity. The work of the unit therefore places much focus on prevention.
So we have programs that are aimed towards persons who suffer from these illnesses. We have started various community-based programs, workplace screening programs, whereby we try to get the population who are at risk of developing these illnesses, and we put certain strategies in place, like encouraging them to form exercise groups, if you're smoking, to form support groups. And very soon next year we'll actually be launching our tobacco cessation program, whereby we not just only offer counseling for those who are wishing to quit smoking, but for also the medical, the drug part of it, like providing if it's transdermal patches or nicotine gums, whatever the need be.
To attract the younger population, Dr. Singh said that sensitization methods are taking a form that this group could easily access information, such as social media, text messaging, and other media. The ministry has recently embarked on the collection of data via a step survey, which is aimed at assessing the at-risk and suffering population in the area of chronic disease.
That way, we're able to target the specific groups that are more at risk. It's not to say that we won't be targeting the entire population, but we know who is more than likely to develop, if it's diabetes, cardiovascular diseases, and we can actually do specific programs just aimed at those groups.
The survey targeted over 3,000 households countrywide and yielded a 77% response. Managing all the elements of the healthcare sector requires a highly skilled workforce. Healthcare professionals who are trained in modern and efficient approaches are key to improved health services. Ongoing training opportunities are a priority area for this administration. The Ministry of Public Health conducts ongoing training for medical professionals countrywide, and Minister Norton has said that he is proud of the number of professionals that continue to be trained through these programs.
We had nurses being graduated this year and already sent out to the different regions, working closely with the different hospitals and so on. We also had environmental health assistants being trained, pharmacy assistants. We had the community health workers all graduating. The patient care assistance was done here, and medical laboratory technicians. These were courses that was done on the health science education.
But the minister has admitted that even with continued training, there remains a significant shortage of nurses, not only at the Georgetown Public Hospital Corporation, but countrywide. Acting Chief Executive Officer of the GPHC, Dr. Sheikha Mir, has said that the working conditions contribute to the turnover.
Generally speaking, the salaries are not the best, and I guess working conditions too. So it's a more holistic reason. Everybody wants better. Right. So you receive training, pay is not up to standard, or so you can go where pay is better, even if it's private sector.
To avoid this, Minister Norton acknowledged that much effort must be plugged into the improvement of these conditions so as to improve job satisfaction among the nurses.
We've got to increase in the quality of training they have, but we also have to give them job satisfaction, social security. We've got to look at it in a holistic way. Make the nurses feel comfortable on the job. They're doing a noble profession. It is something that no health system can do without. As a matter of fact, my take on it is that nurses are the most important pillar in any healthcare system. And if it means a special package, then so be it.
It is these and other challenges that the Ministry of Public Health seeks to tackle every day in its goal of providing quality health care to the citizens of Guyana. According to Dr. Prasad, however, even with these challenges, the overall health care of the country is ever evolving, and there have been significant developments that help to improve standards of health care. But the work of the ministry is never done.
And healthcare is, it's not that you can fix things and they stay fixed. You have to make the effort, like immunization. You get 100% coverage in 1 year, and then at the start of the next year, you start at zero again. You have to work your way up again. So every step of the way, you have to keep, achieving again what you must have achieved previously. So that's one of the distinct difference between the health sector and other sectors, that you have to repeat all these activities again frequently over and over to maintain and sustain your goals.
Good healthcare comes not only with adequate training and appropriate resources, but with a strong and committed team. These are the concomitant factors that the government continues to work on to ensure that the population of Guyana enjoys good health as part of enjoying the good life. This is Jasmine Payne. Thank you for joining us.